now turning to paid family and medical leave in Maine as it's now law. The benefit won't start for about a year and a half, but Mainers started paying for it on the 1st of this year.
Joining us this morning on Arc Maine to talk about the program, the benefits, the cost, and even some pushback now is the author of the bill and now law, Maine State Senator and Senate President Maddie Daughtry. And Senator, you've called this the biggest accomplishment of your political career. Why is that?
Thank you and good morning. It's lovely to be with all of you. This is something that is near and dear not only to my own heart, but I know many Mainers. Maine was the only state in New England that did not have a paid family and medical leave program. And the United States is actually the only country in the developed world that does not have this on a national level. Simply, Mainers shouldn't have to choose between taking care of themselves or a loved one in financial disaster. Over 90% of Mainers really don't have access to leave, whether paid or unpaid. And really, this is about making sure that we are able to save to be able to take care of ourselves.
And this has been a long time in the making. Can you just really reiterate how long this has all been in the works for and what this really means to Mainers?
So this is something that I've been working on since I first got elected when I was 25, after seeing a loved one pass away from terminal cancer. And, I was just one member of many people who've advocated for this. There was actually a commission back in the 90s looking at how we could create a program that works for Maine. We really dug in about 4 years ago when we started having conversations about what we needed was a commission to study this across the state and what type of program would really work for Maine. Because we know what might work in another state isn't necessarily going to work for a state like ours. And so we had a 3-year process. We had a commission made up of bipartisan legislators, as well as folks ranging from large businesses to small businesses, from healthcare to different practitioners. And we studied and modeled every possible iteration of a paid family medical leave program under the whole aspiration to get the most accessible and affordable program for Maine. So for me, this is something that I have been working on for 10 years. But I'm one part of a large coalition and cohort who have deliberatively studied this for many, many years.
Why do you think it took so long? We were the last state in New England. Here's the fact, though, at least we're now one of 13 states that has this. But why did it take so long to get this enacted here in the state?
I think because we are careful. I am really grateful for my colleagues across the aisle and within my own caucus who recognized that we needed to take the time to bring this bill outside of the legislature. So my co-sponsor, Representative Cloutier, and I actually hit the road. We met with local chambers, we met with individuals, we did teletown halls, we were talking to retirees, we spoke with thousands of individuals and really made the time to make sure that we could hear as many voices as possible. We had to be slow and deliberative to make sure that we got the right product here in Maine.
So as we know, this is going into effect very shortly and people are paying into it right now. Who exactly is paying for this and when will this actually kick in, all these advantages for folks? When does that actually kick in for Mainers?
So I know it's a complicated program and I want to try to distill it really quickly. What's happening right now are the contributions. Think about the fact that we save up for many things in our life. We save up for vacations, we save up for our first homes. What we're doing right now is we're putting away our own money to save up to be able to access this type of leave. So folks are doing their contribution. The most that any one Mainer will be paying is 0.5%. The cap for the contributions, and this is for both the employee and the employer, is 1%. One employee will never be paying more than half of that. So this is going to go on as people vest into the program, and then benefits will go live in 2026. I also want to be clear for folks whose employers already offer this type of program. Once the private marketplace goes live, for folks who employers will be purchasing those private plans or offering their own, they will not be paying into the system because they'll be able to access this benefit through their employer. And one of the things that was really key in this bill is we wanted to make sure that we had a robust private free market option as well, but that we also had the state option for those employers or self-employed individuals who might not be able to access the care. So this is available for all Mainers from birth all the way to the grave.
There are many businesses in favor of paid family leave. There are also many who are not on board. The concerns are absenteeism for workers, businesses having to pay into it, and employers wondering if their employees can afford the extra money taken out of their paycheck. That's why some state lawmakers are now trying to repeal it. What can you say to the opponents of this law?
First off, I would say give it a chance. This bill has just started. We are just starting this journey, and we need to make sure that we're continuing to listen to all the voices, but it actually has to be given a chance before we can really go after it. Also, one of the things that I think is really important is that people recognize that there's a paid family medical leave authority that is made up of Mainers, so that they are the ones looking after this program. So it's not just in the hand of legislators, it's in the hands of all of us. And, a lot of people are really wondering what the next steps are going to be, and I really encourage them to get involved. They can go to www.maine.gov/paid leave to follow how it works. But I encourage anyone who has questions to go to that website. My colleagues who are pushing against the program, I really urge them to read the full commission report and see the work that went into it. And also recognize that this is something that is applicable to everyone. I've had some people call and say, I'm not planning on having children. Why should I care about this program? And I want people to understand that it's for all different types of leave, whether you're welcoming a child, military deployment, if you're a victim fleeing domestic abuse, if you're taking care of a loved one. This is something that really runs the full gamut of care.
Maddie, thanks for coming on and breaking down this new law.
Absolutely, anytime.